everyone, I'm Faria Buchanan. I'm making this video about my bunion surgery. I think there are a lot of people out there who wants to go through the bunion surgery, and there are a lot people out there who needs to go through the surgery but they don't want to do it because it's so scary, it's painful, and it takes a long time to recover. I think I can help them with the information. Also, I can help them with my patient's perspective as I'll be going through the surgery. So a little bit background on my bunion is my bunion is a genetic one. I always had it, but also I was wearing heels so much, like I was wearing heel 7 or 8 hours a day, so that even made it worse. And I got to know that I have bunion actually 2 years ago when my sister-in-law was looking at my feet and she just told me that, hey, you have bunion. And I went to see a doctor and the doctor confirmed it. However, at that time, I did not want to go through the surgery. I thought maybe I can cure it with the bunion correctors or other thing. So I tried those, but it did not help me at all. And last year, I was not wearing any heels. All I was wearing is sneakers or sports shoe, and even with the sports shoe and sneakers, it was hurting so much, and I realized, yes, I had to go through the surgery. So I got brave enough this time, and now I'm going through it. I have bunion on my both feet. My left foot is not that bad. The right foot is the worst one. So the left foot, the doctor, all he's gonna do is just shave the bone. But the right one, as this the worst one, they have to shave it, then they have to put screws to make it, aligned. So the foot wise, the right foot is the worst one, and my doctor told me that's the one is gonna take a little bit time to recover. I'm ready for it. I'm doing it 2 foot all together. I feel like just do it. I don't want to go through it for 6 months apart. Just do it. I know it's going to be painful, and I have a support system I can rely on, so why not doing 2 feet together. After this video, I will show you a picture of my foot before the surgery, and then I think I will go through the video like my surgery day and day 1, day 2. I want to make this video just for first week because that's the very crucial week and that's the most important week, and I want to make this video as short as possible. So take a look on my picture before the surgery. So today is my bunion surgery day. I'm ready. I have my boots on. My husband sent me flower. I'm ready for my surgery. Nervous. A little nervous. It's gonna be fine. I'll be fine. Hi, it has been 12 hours of my surgery. Almost 12 hours, and I think I had my surgery around 5 p.m. I came home around 8:30 to 9 p.m. So far I'm good. I don't have any pain that much, maybe because they gave me a painkiller. I'm supposed to take it in every 4 hours, and as it needs. If you don't need it, they asked me not to take it, but I know I need it, so I took it on every 4 hours. I was able to go to the bathroom by myself. I went there 3 or 4 times, tried to put pressure on my heel, not on my toes. I didn't have that much issue going around the bathroom, going to bathroom. I think the surgical boot actually help you to put pressure on your heel rather than toe. I mean, that's how I felt it. It gives you a lot of support, My doctor also asked me whenever I get conscious or whenever I get home, try to move my finger. And I tried to move finger after I got home. I was able to do it, and it did not hurt me that much. And he also suggested me to try to do this, moving my finger twice a day, in the morning and the evening, or whenever you can, but twice a day. Hi, today is the second day of my surgery and I'm definitely feeling the pain. It hurts. I knew but it hurts than the first time. I was able to sleep last night, which is good. Uh, Rather than that, the pain is a little bit more than the first day. I am having a little hard time going to the restroom because of the pain. And doctor asked me to do the toe exercise twice a day, so I did it in the morning and I'm gonna do it in the evening again. Basically what I had to do, push the toe up for a minute and down for a minute, and I did it for both of my feet. So today is the end of the third day of my surgery. So far the pain is much less than the second day. I think I had the highest pain on the second day, and I was able to walking around the whole apartment, and I went to the bathroom. I did not have that much pain. I did the exercise twice, once in the morning, and I just finished the second one, which is like evening one. I'm being able to push my toes up and down by itself, just like this and that. Well, hello! Today is the sixth day, actually end of the sixth day of my surgery. I did not make any video for fourth or fifth day. I did not feel like there too much information to give you. There was not much because I did not feel any pain. I was perfectly fine after third day. I did not take any pain medication, at least for let's see, more than 3.5 days. I don't have any pain. I'm excited about tomorrow because I am going to see my doctor tomorrow for the first time after my surgery. Hopefully he's gonna change the I think he's gonna change the bandage, and he of course he's gonna give me some updates about my bunion and what's going on, everything. So far I can tell you, as I said before, I didn't have pain right after 3 days. I was walking pretty well. The creepiest thing about every time I walked, I felt like I feel the screws. It could be in my mind, it could be in my head, or it could be real. But I felt like every time I walked, as they put screws on my right foot, I feel like I can feel it. Well, hello. I just got back from my doctor and they changed my bandage, which was a really thick one. Now it's a very thin one, and it's very comforting that I don't have a thick one because it was making my feet, very sweaty and gross. I'm happy about that one. All right, they changed the bandage. I'll show you right now, as my right foot is the worst one. I'm just gonna show you that one. I took the boots off on my right foot. As you can see, it's a new bandage, and they put this thing in between my toes, so it's going to be more aligned. My right foot was the worst one. That's why I need to take more rest, because they had to cut the bone and put 2 screws. On the left one, all they had to do is just shave the bone. And that one was not that tricky. If I had only shaving bone, I could take the boots off for this week if I wanted, some time to time. I mean, I can take the boot off and on time to time. But as I have a tricky one on my right foot, he recommended me not to take the boots off because it has 2 screws and it needs to be aligned. And second week is another tricky week. So I will keep my boots on both feet, even though he said I can take off my left foot, which one is only shaved. But well, I'll just keep my boots on. This is the 5th week of my surgery, and I went to doctor, and doctor took my boots off. So I'm walking without my boots on my 5th week. Let me show you. This is an overall review of my bunion surgery on my 5th week after the surgery. So far, I had the worst pain on my second day. I took my pain medication for 3.5 days for every 4 hours. After that, I did not take it because I did not have the pain. But if you have the pain, please go ahead and take it. There is no reason to suffer, you know. I kept my feet elevated straight 2 weeks. After 2 weeks, my feet was elevated, but not all the time. So 2 weeks straight, keep your feet elevated. I was wearing my boots from the very first day of the surgery till 5th week, which was yesterday. My doctor told me, actually yesterday when I saw my doctor, it was my 5th week, he told me I can take the boots out and I can wear something comfortable. You can wear flip-flop or sports shoe. So yesterday I was wearing my sports shoe, my flip-flops, and I tried to put much pressure on my left foot and less pressure on right foot because my right foot, it was pretty tricky surgery. However, my doctor told me if I have the pain, I should put back my boots. At night I had the pain, so today I am walking with the boots, so I went back to my boots while I walk. He also gave me a topical gel. I'm supposed to put it 3 times a day, and it's supposed to help me with the pain and the inflammation. It did help me a lot last night while I applied it. And as I told you before, I was keeping my boots from the very first day of the surgery till 5th day, and I wore it all the time. So while I was sleeping, I was still wearing it. I know it's very uncomfortable wearing it and trying to fall asleep, but it definitely helps you with the healing and the recovery, everything with the bunion surgery. On my first week, my doctor took the bandage out and put a very thin bandage, but I was not allowed to soak my feet for the first week. But the second week, he took the stitches out and I was allowed to soak my feet, but not for long. So if you have any plan for bubble bath, leave it for 4th or 5th week. No bubble bath on 2nd week. Definitely no pedicure for sure. One tip that helped me a lot, the nurse, she was helping me with the bunion surgery, and she told me put ice bag underneath the knee. So I was putting a ice bag underneath my knee, and I kept doing it till 1.5 week, and it helped a lot with the pain. I definitely recommend you to put ice bag underneath the knee. And the exercise, this is the most important thing. You need to keep doing the exercise. I did it twice a day. As the week passed by, I try to do more. Like I used to do it for 1 minute and 1 minute. Now I'm doing it for 5 minutes each foot. And if it doesn't hurt when you do it, that means you're not doing it correctly. So you need to push it all the way up till it hurts and all the way down till it hurts. If it doesn't hurt, that means you're not doing it correctly. So push it all the way up as much as you can and down as much as you can. I'll be traveling on my 6th week, and my doctor suggested me to wear my shoes, the boots, and I'm also taking the wheelchair assistance. It doesn't matter if you travel overseas or if you're flying. Airport is a long way. You have to walk a lot inside the airport. I definitely recommend take the wheelchair assistance, even though you are not wearing the boots, even though you're in 7th week. Why not taking the wheelchair assistance when it's free? Because you're gonna be right after the surgery. So I definitely recommend take the wheelchair assistance if you travel on your 6th or 7th week, no matter what, if you are wearing the boots or not. So this is the overall review and overall tips I got from my 5th week of experience from the bunion surgery. The main purpose of making this video was helping people out with the tips and the information, as I'm a bunion patient. I hope you find this video helpful. If you have any question, please comment below. I would love to answer it. I'm not a doctor, I'm not a nurse. I will give the answer from my perspective, as a patient's perspective, and whatever experience I went through. I hope this video helps you some way. Thank you for watching.